In most cases, it's not true ptosis but other conditions like myasthenia gravis. There are simple tests that ordinary people can do at home. If these children don't receive timely and proper treatment, their visual development may be impaired, increasing the risk of amblyopia. You must visit a nearby ophthalmologist for an accurate diagnosis. Hello, I'm Director Ho from Eye Siblings Clinic. Your eyelids droop too much, it's hard to open your eyes, and you always look sleepy? It sounds like it might be ptosis. Then today, I'll talk a bit about ptosis.
Why does ptosis occur?
It's caused by weakness in the muscle that lifts the eyelid. Ptosis is when the eyelid droops due to that. It can be congenital, or it can be acquired later. Babies born with congenital ptosis often show it right after birth. They can barely open their eyes after birth, but gradually gain function as they grow, even when they reach the age to hold their head up and recognize objects. They can't see straight ahead and lift their chin up to look, because their eyelids don't open properly. If these kids don't receive proper treatment in time, their visual development might be disrupted, leading to a high risk of amblyopia. If you feel like your child is not opening their eyes well, or isn't looking straight ahead, you must visit an eye clinic for a proper checkup. In fact, acquired ptosis is more common than congenital, especially after trauma that damages the nerves, or if the eyelid lifting muscle is injured, or it can happen gradually due to aging. The most common case is elderly ptosis, which occurs as the skin sags with age. But recently, even people in their 20s and 30s are visiting my clinic. Younger people use excessive double eyelid glue or tape, or wear contact lenses too often for long periods. This causes chronic micro-injuries to the muscles, leading to ptosis. In the past, ptosis was seen mainly as an elderly condition, but now it's also very common among the younger generation, so the age range is quite broad.
Do I really have ptosis?
No, in most cases it's not true ptosis but other conditions like myasthenia gravis or other diseases. True ptosis is when the eyelid muscles are too weak to lift the lid. Pseudoptosis is when the eyelid muscles are normal, but excess skin sags and covers the eyes.
Is there a self-diagnosis method you can do at home?
Yes, there are professional tests, but also simple ones anyone can do. Let's grab a mirror. Look straight into the mirror. Gently press on your forehead above the eyebrows to block use of the forehead muscles. Then, check how much of your pupil is visible in the mirror. The vertical length of the cornea is 10.6 millimeters. If about 20% of the cornea is covered, i.e. 8 millimeters or more is visible, it's considered normal or mild and the pupil won't be covered. In such cases, surgery usually isn't necessary. But if only 4 to 8 millimeters is visible, it's moderate ptosis. If less than 3 millimeters of the cornea is visible, it's considered severe and surgery is required. If 30 to 40% or more of the cornea is covered, surgery should be considered. If that method is difficult, just check whether the eyelid is covering more than half the pupil, or if you tend to tilt your chin up to see straight ahead, or if your eyebrows lift when you try to open your eyes, or if you're using your forehead muscles to compensate. If you notice these signs, you may have ptosis. Since the pupil is covered, lifting the chin and using the forehead is a natural compensatory response.
Which should you get first? Ptosis surgery or LASIK, LASIK, SMILE?
This is also a question I get a lot from patients. In short, if procedures are spaced 1 month apart, the order doesn't matter. Whether you do one first or the other makes no difference. Whether it's ptosis correction or vision correction surgery, after a month, both heal well and won't interfere with each other. So after 1 month, order doesn't matter. But in the following cases, the order does matter. First, high school grads, college students, and international students who have about a month before school starts, if they want to get both surgeries done within a month, same for working professionals, it's better to get the ptosis surgery done first, because by then the swelling will have gone down, so your classmates or coworkers won't notice anything. Vision correction surgery can be done just before school work starts and still show immediate results. So if you want to finish both within a month before starting school, I recommend doing ptosis surgery first. Second, if you have severe entropion, inward turning eyelid that has badly damaged your cornea, you must first treat the entropion. After the corneal injury has fully healed, which usually takes about a month, then the exact refractive values can be measured, and you can undergo precise and error-free vision correction surgery. If the cornea is too damaged, it can distort refractive measurements, which makes it impossible to perform accurate refractive surgery, and the results of the surgery won't be good. That's why entropion surgery should come first. If your drooping eyelids are seriously obstructing your vision, don't leave it untreated. Please get examined. If you have more questions about ptosis, feel free to leave a comment anytime. We, the Eye Siblings, will reply sincerely after reviewing your comment. This has been Dr. Ho of Eye Siblings. Bye, everyone.